Welcome back to our channel. Do you know the warning signs of a stroke? This is a question of significant importance, as a stroke can happen to anyone, at any time. A stroke is a medical emergency that occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. It can cause lasting brain damage, long-term disability, or even death. Recognizing the warning signs of a stroke and getting prompt medical attention can drastically reduce the risk of severe long-term effects or death, and that's why we're here. Our mission today is to empower you with knowledge about the warning signs of a stroke. It's not about creating fear, but about fostering awareness and preparedness. In the course of this conversation, we'll delve into 7 key warning signs that could indicate a stroke. So strap in and get ready to become more health conscious and informed. Today we will be discussing the 7 warning signs of a stroke. The first warning sign of a stroke is trouble with vision. Now what does this mean? Well, imagine going about your day and suddenly your vision blurs. Maybe you can't see clearly out of one or both eyes. It's not a gradual decrease, but an abrupt change that can be quite alarming. This is because a stroke interrupts blood flow to your brain, and this disruption can affect the part of your brain that controls your vision. It's like a power outage in a city, where the power grid is compromised and suddenly, parts of the city go dark. It's the same with your brain. Without the necessary blood supply, certain functions, like vision, can be impaired. That's why sudden vision trouble is a significant cause for concern. So if you or a loved one experience sudden vision problems, it may be a warning sign of a stroke. The second warning sign of a stroke is difficulty with speech. This could manifest in a number of ways. For some, it might be slurred words as if they're intoxicated even when they're not. For others, it might be a struggle to find the right words or even uttering completely nonsensical phrases. The brain is a complex organ, and when it's under duress, its communication pathways can get mixed up. This is why someone might have difficulty understanding what others are saying. It's like the brain's language center has been scrambled. This is no minor issue. Difficulty with speech is a sign that the brain is not receiving enough blood, which could indicate a stroke. It's a medical emergency and should be treated as such. Don't wait and see if it gets better. Immediate medical attention is crucial. Remember, sudden difficulty with speech is a serious warning sign. The third warning sign of a stroke is a sudden severe headache. Imagine a bolt of pain striking your head without warning. This is not your average headache. It's a throbbing, intense pain that seems to come out of nowhere. Along with this headache, you might also experience a sudden bout of dizziness or altered consciousness. You see, when a stroke happens, it's because blood flow to a part of your brain has been cut off. This can cause cells in your brain to die, leading to sudden and severe symptoms, including this extreme headache. It's like an alarm bell going off, a signal that something is seriously wrong. Now, not every headache is a stroke, of course, but if you experience a sudden severe headache, especially if it's accompanied by other symptoms like dizziness or altered consciousness, it's crucial to seek medical attention immediately. A sudden severe headache should never be ignored. The fourth warning sign of a stroke is trouble walking. Now you might wonder why a condition that primarily affects the brain would manifest in a way that impedes your mobility. The brain, in fact, is the central command station for all our bodily functions, including movement. When a stroke occurs, it often disrupts the flow of information between the brain and the rest of the body. This can lead to sudden dizziness, a loss of balance or coordination, and of course, trouble walking. It's like the body suddenly forgets how to perform a function that's usually second nature. This sudden and unexpected loss of mobility can be alarming, and rightly so. It's your body's way of signaling that something is seriously wrong. Never ignore or downplay this symptom. It's crucial to seek immediate medical attention if you or someone around you experiences sudden trouble walking. Sudden trouble walking is another key warning sign of a stroke. The fifth warning sign of a stroke is weakness or numbness. It's not uncommon for a stroke to manifest itself through a sudden onset of weakness or numbness. This can be a bewildering experience. It's as if your body has suddenly decided not to cooperate with you. This inexplicable weakness or numbness often occurs on just one side of the body, It could affect an arm, a leg, or even half of your face. Imagine waking up and discovering you can't feel your left arm, or you're struggling to hold a cup of tea. It's disconcerting, to say the least. You see, a stroke happens when blood flow to a part of your brain is cut off. Without oxygen-rich blood, your brain cells start to die, and this can affect your body's functionality. So if you or someone else experiences sudden weakness or numbness, particularly on one side, don't ignore it. It's a crucial stroke warning sign. The sixth warning sign of a stroke is confusion. This isn't the type of confusion you might feel when you've misplaced your keys or forgotten an appointment. We're talking about a sudden, unexplained confusion that seems to come out of nowhere. A stroke happens when blood flow to an area of the brain is cut off. When this happens, brain cells are deprived of oxygen and begin to die. When brain cells die during a stroke, abilities controlled by that area of the brain, including memory and muscle control, are lost. This can result in sudden confusion, trouble speaking, or difficulty understanding speech. Imagine you're in the middle of a conversation and suddenly you can't comprehend what the other person is saying. Or perhaps you're struggling to articulate your own thoughts. These are not just moments of forgetfulness or distraction, but could be symptoms of a stroke. Sudden confusion is another serious warning sign of a stroke. The final warning sign of a stroke is face drooping. This is a telltale sign that you or someone else might be having a stroke. When a stroke occurs, it can cause one side of the face to droop or even become numb. It's as if the muscles on one side of your face suddenly decide to go on vacation without telling you. This happens because a stroke interrupts the flow of blood in your brain. When this happens, your brain cells don't get the oxygen they need to function properly. This lack of oxygen can cause damage to the nerves that control your facial muscles, hence the drooping. This is no small matter, and if it's happening to you, it's important not to ignore it. Face drooping is a serious warning sign and calls for immediate medical attention. If you notice face drooping, especially on one side, it's time to seek medical attention. Let's quickly recap the 7 warning signs of a stroke. We began our journey of understanding by discussing trouble with vision. It's crucial to remember, any sudden changes in your sight, double vision or loss of vision in one eye could be a harbinger of a looming stroke. Next, we delved into the second sign, difficulty with speech. This could manifest as slurred speech, an inability to understand others, or a sudden onset of confusion. Our third sign was the sudden headache. This is not your run-of-the-mill headache, mind you. It's typically a severe, abrupt headache, often described as the worst one ever experienced, and it may be coupled with dizziness or altered consciousness. The fourth warning sign we discussed was trouble walking. This can be characterized by a sudden loss of balance, coordination, or a stumbling gait. We then explored the fifth sign, weakness or numbness. This usually presents on one side of the body, affecting the face, arm, or leg. Our penultimate sign was confusion. This could be sudden confusion, trouble speaking, understanding speech, or difficulty recognizing familiar places or faces. Lastly, we talked about face drooping. This is often one of the most recognizable signs of a stroke. One side of the face may droop or feel numb, and when the person smiles, it may appear uneven. Each of these signs is a crucial piece of the puzzle. They are like bright red flags waving, urging you to seek immediate medical attention. Time is of the essence in these situations. The sooner the treatment begins, the better the chances are of reducing the damage that a stroke can cause. Awareness is our greatest weapon in the battle against strokes. By understanding and recognizing these 7 signs, you arm yourself with the knowledge to potentially save a life, maybe even your own. Remember, recognizing these warning signs can save a life. Stay informed, stay vigilant, and take care of your health.